Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
Howdy, 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 hi. Do you guys remember that? That's like from the Blues Brothers, Cab Calloway, when he was singing that song, Minnie the Moocher. I'm probably really dating myself, but I'm really old school. The Blues Brothers was like an amazing film. Lots of great music. Aretha Franklin was in there, Getting It to Respect, the whole thing. So, how's it going? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I am so excited to welcome you to episode 24 of the Ask Dr. Angela podcast. I am en route to my amazing guitar lessons, and it's just something that I've picked back up. My little girl plays piano beautifully, and she said to me one day, "Mommy, why don't you just, play your guitar some more?" And I thought to myself, I'm like, why don't you? So I have been jamming out, and my musical tastes vary across the board. I'm playing some Rick James, Super Freak, U2-1, The Churches Under the Milky Way, just went total 80s, recently learned Tears for Fears, Everybody Wants to Rule the World, and I don't know what I'm going to work on next, probably some Stones. Who knows? I'm thinking some Stones, Phil and Mick. Anyway, let's jump right into today's question coming to us from Deneen. Deneen, what you got for us?
Hi, Dr. Angela. This is Deneen from Newark, New Jersey. And my question is, how does being overweight impact my ability to have a healthy pregnancy?
Deneen, that's actually a really good question. First of all, if you are obese, and that's defined as a BMI greater than 30, that's in kilograms in weight per meter squared in height, congratulations, because certainly obesity in and of itself puts you at an increased risk for a lot of things, including PCOS, anovulatory cycles, increased risk of miscarriage. So if you are actually able to conceive and are moving and grooving along in your pregnancy, first of all, kudos. Secondly, being obese puts you at an increased risk for many, many, many different things. First of all, let's talk about gestational diabetes. Let's talk about hypertensive disorders, preeclampsia being at the top of that list. Did I say preeclampsia? Yeah, I meant preeclampsia being at the top of that list. Let's talk about increased risk of C-section, and that presents a whole nother source of complications and issues, which I will address in just a few moments. Let's talk about issues with pain management, issues with having to get epidural and spinal placements for my really obese patients. One of the things that I oftentimes will do is get anesthesia on board really early because I like to make sure that we have something in place for pain in case of an emergency situation. Did I mention labor abnormalities? Did I mention increased risk of C-section? Did I mention increased risk of your baby later being affected with things like diabetes and heart disease? If you do end up with a C-section, you have a much greater increased risk of wound infections. The other thing with obesity is that you are less likely to have a successful VBAC or vaginal birth after a cesarean section. So, in a nutshell, obesity in and of itself puts the pregnancy at a huge risk for many different things, a lot of which I've just mentioned. So it's really important, and in my preconceptional counseling and my patients that are overweight, we try to incorporate healthier lifestyle, healthier dietary choices, and exercise so that we can lose some weight in order to affect a better outcome during the course of a pregnancy. And I always tell folks, it's not about just losing weight, but it's about creating a healthier lifestyle that is going to benefit both you and your family in the long term. So, Ms. Deneen, I certainly hope that I have addressed your question, giving you an answer and even a little bit more. Thank you so much for contributing a question to the Ask Dr. Angela podcast. For doing so, someone from my team will be reaching out to you so that we can send you one of our bomb-ass t-shirts. For those of you that are listening that would like to have a question featured on the Ask Dr. Angela podcast, please do so by going to www.askdrangela, that's AskDrangela.com. There's a microphone on the right-hand side of the page. Click on it and do what you do. In closing, I'd like to leave you with this thought. God changes caterpillars into butterflies, sand into pearls, and coal into diamonds, using time and pressure. He's working on you too. That comes from Rick Warren. So just remember, butterflies, pearls, and diamonds, I'd say the pressure is worth it. Don't quit. Until next time, look better, feel better, be better. Can't wait to see you and reconnect on episode 25 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.